So arrange objects in a manner to get full benefit of the laminar flow of the air. Critical items should be placed as close to the air source as possible. In a horizontal hood, items should be placed no closer than 3 inches from the very back of the hood. This is also important. I'll repeat it again. Items should be placed no closer than 3 inches from the very back of the hood. And why is that? Well, if you go back here and look at the picture of the vertical flow hood, this isn't really going to get the best airflow 3 inches back. So we've got to make sure that we work that. When working in a horizontal laminar flow hood, all work must be performed at a distance of no less than 6 inches from the front edge of the work surface. At a distance of less than 6 inches, laminar flow hood air begins to mix with the outside air and contamination is possible. This is also important. All work must be performed at a distance of no less than 6 inches from the front of the edge of the work surface. All right, remember that 6 inches from the front, 3 inches from the back. Wash your hands for 30 seconds. Clean from side to side, back to front with 70% isopropyl alcohol. And what did I say? There's one more thing. Okay, I think there wasn't another thing. So there's that. All right, so after spraying or squirting solution onto the HEPA filter, oh, that's what it was, okay. And then also remember that the hood needs to be turned on for 30 minutes before use. So there, got that squared away. All right, avoid spraying or squirting solutions onto the HEPA filter. Always aim away from the filter when opening ampules or adjusting syringes. Outer pouches and wraps should be removed at the edge of the work area as the sterile contents are pulled into the work area. Never bring these items into the main work area. Large objects should never be placed near the back of the hood. Not only do these objects contaminate everything downstream, but they also disrupt the laminar flow pattern of air, which normally suspends the contaminants and removes them from the area. Remember, laminar flow hoods do not create sterility. The purpose of the flow hood is to maintain already sterile products. All right, so if you put something dirty into the hood, everything is going to get as clean as that dirty molecule or as that dirty item. So just remember that. All right, aseptic technique. When working with glass ampules to prepare an IV mixture using aseptic technique, a filter needle must be used. When recapping a needle, use the one-handed scoop method. Place the can on the bench top and hold the syringe in one hand. Keep the other hand by your side. Slide the needle into the cap, then lift it up and snap it on securely using only one hand. Okay, and I'll try to go ahead and include a video below to help with that. And I'm making a note of that right now. Okay. So chemotherapy preparation guidelines. Now, normally, no matter what pharmacy you're working at, you're not going to be doing chemotherapy. That's going to be up to the pharmacist, but it's still important for you to know. Protective work clothing is essential when preparing chemotherapy agents. The pharmacy should have detailed written guidelines on what staff members should wear when preparing chemotherapy products. The following protective work apparel should be utilized for preparing chemotherapy agents. Powder-free, disposable latex-free gloves. Use a double glove technique, one glove under the disposable gown, the other outside the disposable gown. The outer glove should always be changed if contaminated at any point while preparing products. And then also a protective disposable gown. Final products should be appropriately labeled with patient-specific dose information or auxiliary labels that indicate the product contains chemotherapy agents. Final products should be contained in a sealable container such as a Ziploc baggie with chemotherapy and patient-specific labeling on the outside. That's important as well. What needs to be labeled? Well, you're going to have the patient-specific dose information, auxiliary labels, the products of the chemotherapy agents, and it needs to be placed in a Ziploc baggie with chemotherapy and patient-specific labeling on the outside, like I just said. Okay. All right, so some chemotherapeutic medications. Antineoplastic agents, These are also known as anti-cancer drugs, which are used in chemotherapy. Chemotherapy treats cancer by killing cells, thereby suppressing the active disease state. It is expected that a quarter of the population will experience a cancer diagnosis within their lifetimes, and cured cancer is commonly correlated to a 5-year remission state. So if you have cancer and they get rid of it, you're not considered cured until you have been free of it for 5 years. Cancer is created when cells no longer control their cell division processes and divide uncontrollably at the sake of the body's normal healthy cells. Therefore, they do not serve their proper functions in the body anymore and are then denied or defined as cancerous. There are 2 types of cancer states. It can either be malignant, which spreads throughout the body. The spreading is defined as metastasis, or benign, which means they're confined to one site. Cancer is not simply a single condition, but a group of diseases interacting in a certain area or various areas. For example, breast cancer has different characteristics than lung cancer. In addition, the name of the cancer is always taken from the cancer site of origin. Cancer medications work by interfering with the cancer cell's ability to divide and reproduce. Unfortunately, these medications are not only absorbed by the cancer cells, but also normal cells, causing adverse side effects. Typical adverse effects include nausea, vomiting, hair loss, reduction in white blood cell count, and lethargy. As a pharmacy technician, typically you will not be involved with the preparation of these drugs, but should be aware of their properties and names. These include the following, and then refer to page 65 through 66. Now we have crash carts. In a hospital, a patient might crash or require immediate attention while experiencing a life-threatening event. The medications needed would be found in what is known as the crash cart. The crash cart is a cabinet on wheels that is kept locked up with a tamper-proof seal. To use the cart, the healthcare provider breaks the seal of the drawers and takes the required supplies as they are needed for the event. After use, the cart is brought back to the pharmacy where the drawers are restocked, rechecked, and sealed by a pharmacist. So you basically don't even touch a crash cart. Unless they say bring the crash cart, you grab the crash cart, you take it to them. But restocking it or getting things or even knowing where things are is not important. But it is important to know where they're at. So crash carts are located in areas of patient care in case of a life-threatening occurrence. Physician, nurses, pharmacists, and respiratory therapists must become familiar with the contents of this cart. The Center for Nursing Education has provided this website review to familiarize all personnel with crash cart contents. We don't have that because we don't need to become familiar with it. And it's not in the test. So, nitroglycerin patches should not be stocked on an adult crash cart. So, parenteral products. Parenteral products are drugs administered via outside of the GI tract, primarily by injection. These drugs must be administered using aseptic technique, meaning free of microbial contamination. Now, the reasons to use parenteral drugs is because unable to take drugs orally. Maybe they're in a coma or comatose, nauseated, they're throwing up, unconscious. If you put it in while they're conscious, then they could die or choke on it, and vomiting. Yeah, so the drug is not available in oral form. Emergency situation requires immediate drug blood levels. Drug cannot be given via the GI tract, for example, insulin. Now, the advantages of the parenteral products is rapid onset, more predictable absorption into the bloodstream, medication is able to avoid, absorption and dissolution before entering bloodstream. So, like this, if you take it into the mouth, then it has to go through your whole system before it gets to the right place, where it gets to your blood cells, because medication gets into the bloodstream and the blood transports it to where it needs to go. Some of the disadvantages is the risk of infection. Rapid absorption means that medical errors are magnified and hard to reverse. Because it's so quick, if you inject something into someone, there's no takebacks because it's already done. Unacceptable to many patients due to pain and psychological trauma and being given an injection, and then requires sterility. All right, so the syringe. Parts of a syringe. You have the barrel, which is the tube with calibrations. Needles may be attached to it. And the plunger is the tube fitting inside barrel and has a rubber piston at one end. Note, the capacity may range very small from 3/10 cc to very large, 60 cc and larger. Needle size is designated in two ways. The gauge, which is the diameter of the needle's opening or bore. The range can be from 27 to 13, with the larger the number, the smaller the needle bore. So 27 is going to be very small, 13 is going to be very big. The needle size, also length, ranges from 3/8 to 3.5 inch. Specialty needles. There's different kinds of needles. There's the transfer needles, two needles attached together at their hubs to transfer sterile solutions from one vial directly to another without using a syringe. And then filter needles contain a small, usually 5-micron filter to trap particles before they are administered through the needle. When working with ampules, you must use a filter needle, because if you inject particles into someone's blood, that could be very fatal. So you don't want to do that. Vials. Containers of injectable medications with rubber tops or diaphragms secured by aluminum band and protected by plastic or aluminum tops. These diaphragms must be swabbed with alcohol prior to inserting the needle to ensure sterility of product inside and remove any particulate matter that might get pushed inside by the needle. After using alcohol, be sure to allow the surface to dry before puncturing the diaphragm. An equal amount of air to the amount of drug to be withdrawn is introduced into the vial to equalize the pressure that will occur when drug is removed from the vial for non-hazardous drugs. For hazardous drugs, it is best to introduce a slightly smaller amount of air than the amount of drug you will withdraw to maintain negative pressure within the vial, so that the medication is not able to squirt out as it would if positive pressure were the case. When too much air has been introduced to the vial and the contents want to relieve the air, some of the contents are squirted through the diaphragm. Vials can be either multi-dose or single-dose. Now there's different types of IV administration. There's IV injection, which is a small amount of drug administered via syringe into a small amount of time. Then there's the IV infusion, large volumes over large periods of time, used for replenishment of fluids, nutrients, or as a liquid vehicle for drug administration, may be continuous, usually large volumes, or intermittent, short specific time period and smaller volume. For example, 100 milliliters of an antibiotic solution containing one dose every 6 hours. IV infusions are commonly administered with an IV piggyback, IV-PB, with the PB portion hung in a bag slightly higher than the solution in order for a liquid to flow through. Now it's going to be important to know what the characteristics of an IV solutions are. IV solutions must be clear. They may be colored but not cloudy. If it's cloudy, that's an indication of particulate material. One exception to this rule is fat emulsion for the TPN administration. They must also be sterile, as close to the neutral and pH range as possible, and contain the same number of solute particles as blood, isotonic. There are some incompatibilities of IV admixtures that would need to be considered. Physical incompatibilities involve the change of solubility of one of the drugs being mixed, evidenced as a settling out of precipitate, or a cloudy haze, or sometimes only evident after refrigeration or standing. Chemical incompatibilities involve pH changes when drug solutions are mixed or there is decomposition by light. Chemical incompatibilities may go undetected since there may be no visible sign of incompatibility. This is also important to know. Storage temperature requirements. You're going to want to know the freezer is -25 to -10. Refrigerated is 2 to 8 degrees. Room temperature is considered 15 to 30. Incubator warm is 30 to 40. Excessive heat is greater than 40 degrees. And those are all degrees in Celsius. If you just memorize what those are in Celsius, and you know the formula for converting Celsius to Fahrenheit, which is found in another video, week 1, I think, that we've already talked about. You'll be able to convert that and not have to worry about memorizing both those temperatures. Now, drug classes, you have the hyperlipidemia, the anticoagulants or the antiplatelet, antidepressants, and anticonvulsants. The hyperlipidemia drugs, they lower the LDL, the triglycerides, or total cholesterol. The strong link between high serum cholesterol levels and cardiovascular mortalities may be caused by obesity, inactivity, cigarette smoking, excessive alcohol intake, high carbohydrates, genetic disorders, and diabetes. Drugs ending in statins, side effects. So if you're taking a statin, a possible side effect may be headache, flatulence, or liver toxicity. This is important concept to grasp. Statins side effects. The side effects of some medications are going to be on the exam. So if you know like the side effects, you'll be solid. Patients need to have a liver function tested. Also, if patients report muscle weaknesses, notify physician immediately. Anticoagulants or antiplatelets. These drugs are used to stop, slow, or reverse the coagulation process. When blood clots form, they travel to various organs, causing such disease states as stroke, myocardial infarction, or thrombosis. Close monitoring of patients taking these drugs is essential, or the patient could bleed to death. And this basically just makes your blood very thin. So food and drugs can affect the level of Coumadin. INRs must be done to regulate clotting times. Patients need to watch for unexplained bruising, bleeding, gums, and unusually long bleeding times after small nicks. Antidepressants. Tricyclic antidepressants, or TCAs. These drugs work by inhibiting the reuptake of norepinephrine at the neuron synapse. TCAs can cause birth defects, can lower seizure thresholds, affect cardiac conduction, and cause urinary retention in prostate patients. TCAs should not be used in patients with narrow-angle glaucoma. Antidepressants. Selective serotonin reuptake inhibitors, or SSRIs. These drugs work by inhibiting the reuptake of serotonin of the neuron synapse. SSRIs cause birth defects, rash, photosensitivity, hyponatremia, and possibly cause problems with the blood. Drug interactions with MAOIs can be fatal. Some more antidepressants. Monoamine oxidase inhibitor. That's what the MAOI stands for. These drugs work by inhibiting the enzyme monoamine oxidase, which is the enzyme responsible for breaking down the neurotransmitters norepinephrine, serotonin, and dopamine. These drugs are not used very often due to the drug interactions and food interactions. Tyramine content in food. Anticonvulsants. Epilepsy, or seizure disorder, is a CNS disorder characterized by abnormal or uncontrolled bursts of electrical activity within the brain. When the impulses surpass the normal threshold in the brain, abnormal movements or perceptions frequently occur. It is not uncommon to use more than one anticonvulsant to control seizures. These agents are never withdrawn abruptly, so you're going to be weaned off of it. All right, so Sig Codes. If you're listening to this and not watching it, I will give some time I'll read these and I'll give you time to answer them. I won't give you very long, but I'll give you some time to answer them. I'll say the Sig code and you tell me what it is. Q means every. QOD, every other day. QPM, every evening. Q4H, every 4 hours. Q8H, every 8 hours. BID, twice daily. QID, 4 times daily. PRN, as needed. OS, left eye. GTT, sometimes GTTS, drops, as in eye drops, ear drops. PC, after meals. CW, chest wall. SQ or SC, subcutaneous, AU, both ears, AD, right ear, Q4-6H, every 4 to 6 hours. Now, I'll give you a hint of how I remember for AU and AD. You know, U kind of looks like a smile. And when you smile, the ends go on both sides. So if you put a smile on, the end of your smile points to both eyes or points to both ears. So it's going to be both. Now capital D, that's going to be facing right. So capital D is going to be your right ear or your right eye. And then in opposite of that, you have S. An S, the bottom of the S goes to left, so that's going to be your left. But if you remember the U and the D, S should be really easy to remember. All right, some more Sig codes. OD, right eye. AC, before meals. IEN, in each nostril. SL, sublingual. U, units. AS, left ear. SOB, shortness of breath. PO, by mouth. QD, every day. QAM, every morning. QHS, at bedtime. Q6H, every 6 hours. QW, every week. TID, 3 times daily. UD, as directed. OU, both eyes. All right, and here are some terms for the math that we've talked about previously. So the AWP, this stands for the average wholesale price. This is the price the medication was purchased for by the pharmacy, hospitals, or wholesalers, and will typically be sold at a different price, either discounted or marked up. Then you have a markup or gross profit. This is the difference between the average wholesale price and the selling price. Do not confuse this with the percentage markup. The actual markup is a dollar amount. For example, AWP is $3 and market price is $3. Add the two together to get the retail price, $6. Percentage markup. This is the percentage that a pharmacy uses to determine the markup amount. Example, 50% markup on a $2 med. Overhead is another term. This means this is the amount of all the costs incurred in operating the pharmacy. Markup amounts are generally used to pay for these costs. So overhead would be your electricity, your water, the building, the rent, those things. Then there's the professional fee. This is the flat fee the pharmacy will add to the price of the medications. It is typically added after the markup and is usually referred to as the dispensing fee. The gross profit is the portion of the markup amount that is left after the overhead has been subtracted. This is the profit after expenses. Retail, this is the price paid by the patient. This is calculated by adding the markup amount to the average wholesale price. Wholesale, this is the price that a wholesaler charges to the retailer. Here are a few more practice problems. I'm not going to go through these because we've been going through these already, but go ahead and, if you'd like, place the video on pause and try to do them yourself. All right, and that's going to be it for week 4 of the pharmacy technician course. If you have any questions, like I said, please feel free to message me, email me, comment on the video, and happy pharm teching.